name is Yenny Lim and I practice internal medicine. I enjoy internal medicine because it is a primary care specialty and I enjoy taking care of the whole patient and looking at everyone in their entirety. But also, what's fun about internal medicine is you get to take care of the patients from when they enter your practice till later, and it's just a nice continuum of being able to have a bond and a relationship with the patient. Being an internist, we take care of a broad spectrum of patients from 16-year-old up to 100 plus years old. So you can see how patients develop in age, and what's interesting to see is those patients who really are very proactive in their health care early on are doing very well at 100 or 100 plus years old. So I'm very interested in the whole preventive aspect and how to keep patients well. So I can see them as 100-year-old patients golfing or dancing or whatever. So that really actually is very interesting to me. I think primary care physicians are important, specifically in this day and age with the internet and other modes of getting information. There's a lot of information out there regarding health questions. There's TV shows that give patients advice regarding what to do in certain situations. And I think a primary care doctor is very important to help guide a patient to decide what really should be done, what is really recommended, really how to navigate all of this information. There's just so much out there, and a primary care physician, I think, is good in helping to teach and to show patients really how they can take care of their health and themselves. So the most satisfying part of my job is the whole relationship that you develop between the patient and the doctor. You get to see them when they enter your practice, you help them through problems as they arise, and then you watch them age. And it's such a wonderful experience to see patients, and they become your family because you see them when they're young, and then as they get old and age and get married and have kids and things like that. So that actually is the most satisfying part of my job, that you actually get to maintain these relationships for such a long period of time as an internist. If a patient comes to me and asks, how can I live to 100 years old and be dancing or golfing? I usually recommend that they just have to make very wise lifestyle choices. Eat right, exercise, everything in moderation. And so I advise patients they just have to take responsibility for the choices that they have, and know that their decision now will affect them when they turn 80 or 90 years old, and hopefully in a good way. If a patient wishes to establish with me, I would like them to know that their health and well-being is my top priority, and I'll do my best to keep them healthy, to solve that problem, to figure out that question, but I really have their interests in mind, and I only want to help them.